if you want
So I just, I'll do just a quick welcome. I'm so glad that so many of you were able to join us and log on. So this is great. And I'm glad that this is a topic of interest to you, as we know it is. I mean, it's clearly it's a moving target. Things change regularly. Everyone has to be focused on health and safety of everybody while open and serving families. And I know this is a concern of everyone. So what we're doing today, as I had said in the email, is kind of, we will be reviewing the process, hearing from a couple of people who have agreed to speak and share their experiences. We have Kelly Romanoff from the Brancic Foundation, and she will talk a little bit about how all this came about. We have Chuck Henry from the Health Department. I believe we have Jill and Fatima from licensing that are participating, as well as all of you. And we have certain providers who have already been implementing these, who served on a task force, and they will be speaking about their experience, because I know people have concerns about what's doable, what's not, what's allowed, what's not, and so we want to be able to hear from people who are in the field doing the work, as well as hear any concerns and questions. And there's a couple of changes to the document that we already know we need to make, which has to do with the right phone number to call at the health department. So we will be updating that document and getting that out. There could be some other changes that we might need to make, so we didn't want to send that out till after this meeting. So that's it from me. I am so glad you all are here, and I'm going to turn it over to Kelly to do a little bit of introduction about the whole process.
Yes, thank you so much. It's great to be with you all. And I would also like to acknowledge on the call today, my colleague from the Community Foundation of Sarasota County, the Director of Education, Nicole Light. You may recognize Nicole's name. She's maybe 6 months into her post, a former Sarasota County school teacher, and oversees the Community Foundation's Kindergarten Readiness Grant Program. So hello, Nicole. Thanks for joining us.
Hi, Kelly. Thank you. Hi, everybody. Yeah, actually, September will be 1 full year. So go me.
Wow.
Here.
So the Brancic Foundation, for those of you that don't know, we are a private foundation serving Sarasota County, established by Charles and Marjorie Brancic, wonderful people who unfortunately left us together in December. But we continue to carry on their legacy, and part of their philanthropic passion and really who they were as people was a vision in giving every child and family an opportunity to thrive. And they loved kids. Therefore, they loved you and the work that you all do every day. So we're fortunate at the Brancic Foundation to have a relationship with several of the nonprofit child care providers, but are so fortunate to get to know more of you through this work. When COVID hit, there were no easy answers and a lot of hard questions being asked. And rather than navel gaze or wait for someone to come with a wand and tell us what to do, we just decided to try to figure out something for ourselves and to try to make the best of what we can offer in our local community, to try to keep our families safe, to try to give you all some support, to try to protect you all as professionals from, these are really hard safety issues. There's a lot of information and material. So essentially this is just us being our own leaders and trying to come up with community solutions that are right for us and the families that we all serve. So thank you for giving me the privilege to learn more about your business and work with you. And Janet knows, and for those that we already have relationships with, if there's ever anything that the Brancic Foundation can do for your center or that we should know about, please do reach out to us. In all of this work, one of the leaders who has shone brightly and been just a steady guide for us is Chuck Henry. And we are so fortunate to have Chuck at the head of our County Department of Health and also with the Florida Department of Health. Chuck has had a really long, high quality career, and I'm so thankful to have someone with his experience, professionalism, and collegiality in the position that he is during this pandemic. So with that, I would like to introduce Chuck to add any comments to today's call.
Thank you, Kelly.
I worry who are you talking about there? Very,
You're
very
welcome to
generous.
ask me to say all those nice things about you.
It's a pleasure to be here and always to be part of this group. And as many of you know, I am part of the board for the Early Learning Coalition and have been in that role for almost a decade now. So I'm very familiar with these projects and others that impact our children around the community, and I think they're important. I will say that I think the committee did a great job of putting the information together. Our role at the health department was pretty minimal, just reviewing things and commenting and making sure it stayed aligned with the ever-changing guidance from the Centers for Disease Control and Prevention. And sounds like we missed some phone numbers that we should have caught. So I'm glad somebody was paying attention. I too agree that our community is not where we want to be when it comes to the current COVID-19 situation, but it is here and it's our reality, and it certainly appears that things are going to continue to move forward, both with our community opening up and with schools starting in the fall. And so to have the best possible plans in place to protect our children and their families makes me feel a little bit better. So that's really the only comments I have, and other than I'll stay on because there may be questions as we go through the document.
Thank you, Chuck. We really appreciate your input, both when these were being developed and validating what the committee had come up with and being there as a resource for us. So we really appreciate that. So I think next on the agenda is Kathleen Sullivan. I think I don't have the agenda in front of me, Kelly, but I think we had thought that Kathleen Sullivan, who, has been working on this for her own Children First Head Start centers, and she really had been instrumental in encouraging an initial task force to be developed to work on these protocols. And so I think she was going to speak to that a little bit as to why it's so important that we have common protocols in our community. So Kathleen, I see that you were on, so.
I'm here. Can you hear me?
Good. Yeah, we can. Yeah.
Perfect. So thanks very much. And I'm really excited that there are 49 people on the call. I just love our early childhood community here in Sarasota. I really just have 4 points that I want to make that felt most salient to me with regard to the work of this committee. And so I'm just going to share those with you so that we are sort of grounded in the framework for this. So first and foremost is industry standards. The early childhood field is built upon and thrives within industry standards. These standards protect children, support families, guide staff, and protect our livelihoods. In the unprecedented circumstances created by the pandemic, we have excellent guidance regarding best practices from the CDC. However, we have no industry standards by which program operations may confidently be administered. Interpretation and implementation of the CDC standards can really vary depending on your point of view and your situation within the early childhood field. So by developing and agreeing to basic industry standards, what we do is provide a framework within which our industry may continue to thrive. So that's the first point. Everything we do is guided by industry standards. So here, where there was great guidance, but not a real framework for us, what we have done as a community is come together and develop that framework for our community. Of course, paramount to this and central to this is the health and well-being of children, families, and staff. We all seek to provide safe, healthy learning environments for our children. This is a primary goal for our industry. Shared protocols for addressing the coronavirus offer us the tools we need to provide optimal conditions for the protection of all stakeholders in our community. This begins with our staff. Our programs function at their peak when our staff are well, and that's physically well and emotionally well. Staff have to feel comfortable coming to work, that the organization, the business for which they work, is going to protect them. When they are able to come to work every day and perform their job duties expertly, as we expect, then our programs thrive. Next come the children. The children we serve excel due to consistent attendance in high-functioning early childhood environments. The protection of their health and the health of their parents is key to their consistent attendance and to their development and growth under our tutelage. With industry standards in place, parents will feel more confident about placing their children in our care, so that we may do the work that we love doing, and the children may receive the instruction and the experiences that they deserve. And I will just tell one quick anecdote here. I was speaking with an administrator at the Sarasota School District, and we were looking at the protocols I had developed for Children First. And I said, you know, we are also completing industry standards for our community. And this administrator's eyes lit up. She was so relieved to hear that there would be industry standards for our community that she could base her work in. That it was just like a very clear demarcation in our communication, in our conversation. And the first comment she made was, parents will feel a lot better. They'll feel much more confident in bringing their children back to school if we know their industry standards. So I just wanted to share that because it was sort of gratifying. The next point I wish to make is around the protection of our programs and our industry. And so this is sort of the risk management aspect of this. Agreed upon standards provide a safety net for our industry. Should a concern arise within early care and education pertaining to coronavirus, these standards will serve as a protective mechanism for our businesses and our organizations. Each organization will be able to state confidently that it is following the best practice standards for our industry, that the standards are firmly grounded in the guidance from the CDC. These standards have been guided by and reviewed by the Department of Health and are authorized by the Early Learning Coalition. So there's nothing better than that when you're facing a challenge in your work, to be able to stand firmly and confidently on solid ground that our industry provides for us. And that's what these standards do. They provide the framework for that confidence. Finally, and this is one of the things I just love about early childhood education, I want to talk about our leadership in the community. Developing industry standards illustrate who we are as a group in the community. We're leaders, we're thinkers, we're innovators. We're professionals who understand the gravity of this situation and are taking the steps to ensure our competent response to it. This leadership is emblematic of the early childhood field, the field to which many of us on this call have dedicated our lives. And I personally am proud to be a part of this initiative. I'm proud to be a part of the Sarasota early childhood education community. And I'm really looking forward to our protection of this beloved landscape, again, to which so many of us on this call have dedicated our lives. And that's really where it stands for me, is these four pieces. And of course, the fourth one came last as a result of getting together with colleagues and working on these standards. But really ensuring that we've got the firm ground beneath us so that we're confident, our staff are confident, our families are confident, and our community can have trust in what we're doing. Those are the reasons for this work. And with that, I'll mute myself.
Not for long. She never does.
Oh, wow. Snap.
Kathleen,
Good
thank
thing.
you.
That's a compliment, Kathleen, because you always say wonderful things.
Yes. So thank you for that. And I'm so glad that there are people out there who can articulate things so much better than me. And that was fabulous. And I also, you know, recognize that when Kathleen comments that our early childhood community needs to be valued and recognized for the fact that we are professionals doing really important work. And I know that Kelly and the Brancic Foundation have been working to promote that by doing press releases and explaining that what is happening in our community. And so we are thankful for that as well. So Kelly, did you want to say something else? It looked like you wanted to say things. Okay. So again, thank you, Kathleen, for framing the practical discussion to come of how important this is and why it's important. So the next part of the agenda is Susan Carney, who's from the Florida Center, and Barb Levesque from St. Mark's Preschool. So the Florida Center has been open pretty well. They were closed briefly and then they reopened pretty quickly. And they are one of the nonprofit agencies that the Brancic Foundation has been involved with. And they were part of the work group to develop the protocols. And so they were open for a longer period of time. Barb at her center, St. Mark's, was closed for several weeks. And so she was able to reopen when these protocols were coming kind of up and online, and she was able to be part of a group to comment on them when they were getting finalized. So we have perspectives from two different people to share in terms of implementation of the protocols and how that has helped families to feel confident in bringing their children there, and for the staff to feel comfortable, and obviously for the children to be safe and getting a positive experience as they return to preschool. So I'll turn it over to maybe Susan to start, and then Barb to join in and go from there. So Susan, are you on?
I'm here. Thanks, Sharon.
There you are. Hi.
I'm here. I'm Susan Carney. I'm the principal at the Starfish Academy at the Florida Center. We, like Janet said, closed for a couple weeks and then reopened once we felt confident in our policies. And I'm here to tell you that there is some light at the end of the tunnel, that it does seem incredibly overwhelming at first, but it is doable. We've been using the guidelines since May. It has been trial and error. Things on paper look fantastic, and then sometimes when you go to implement them into your center, you say, oh my gosh. And I want everyone to understand that, and it's okay if you're going through these and you're doing your best to meet all these standards. There are going to be times where it's not going to work. Someone's going to forget a mask, someone's going to forget to clean, and that's okay. We're doing the best that we can. And I also want to talk about real briefly that it is temporary. Although we tell our staff and we tell our families that these new increased measures are temporary, the reality is it has changed our industry. And although the extent of the new policies and guidance are temporary, are going to be long-term. We have changed everything that we do, and realistically, we're going to keep a lot of those changes going forward. Parents used to ask before when they were on a tour or you get the phone call, I get questions about curriculum, I get questions, are you a peanut-free facility? What are your hours? I don't get any of those questions anymore, not any of them. What I get is people and parents and families calling to ask about our new safety procedures. I think that I have had anybody disagree with our safety procedures yet? They are our safety procedures, and we choose to approach them almost as a marketing tool. I don't start with how it used to be. I start the conversation with, this is what we're doing to keep your children safe. And we go down the list of our new safety procedures. We don't dwell on how it used to be. We just present it as, this is what we're doing to keep your child safe. We do have pushback from parents occasionally, but when it's framed in, this is what we're doing to keep your child safe, it goes away very quickly. Staff as well. Staff, you look at a teacher's day, and a teacher's day is completely different than what it used to be. We joke here a little bit that our ladies come to work, our teachers come to work, and it used to be you come to work, you have a cup of coffee in the kitchen, and then you go to your classroom. Now, as it is, I'm sure in a lot of centers, we are wearing scrubs, and we have face shields, and we have masks, and you have your gloves, and it's a whole different world. So for staff as well, we like them to know that we're doing it for a purpose, and we're doing it to keep them safe and healthy as well. I also want to talk a little bit, just briefly, as a thank you to everybody who's on this call, and especially to the directors that are on this call. I know as a director that all of this probably falls on your lap, and you're the one doing the temperature check, and you're the one enforcing the mask rule, and you're the one talking to parents. And I also know that your day was full to begin with, and now all this is on your shoulders. And I appreciate you taking the time to do what's right for our industry. I love early childhood, and I want to see our industry continue on. I want to see centers open. I want to see us all keeping high standards so that we can have our industry back again. Like I said, it's not like it was before. It's how we're going to be in the future. So the light at the end of the tunnel is that it is doable. It doesn't have to be exactly how it's written. You will have some changes for your center, but going at it with a positive attitude and going at it as we're doing this to keep your kids and my staff safe really does change the narrative a little bit. So thank you.
Oh, thank you. Thank you, Susan. That was great. Barb, I know you're on. I saw you. So
Yes.
you wanted to share your perspective of having been closed for quite a several weeks, quite a bit of time. And then
Actually,
you
we
had to
Mhm.
bring everybody back.
We were actually closed from mid-March, and we didn't open until June 10th. And we were coming up with some documents that were very similar to these for when we opened. And then when Janet invited me to come on and be part of what was evolving, I was really happy, because it seems like any kind of documents like this help all of us in our work, that it's not just coming from us, it's coming from a group of directors, it's coming from people like Chuck with background in the health department, from the ELC, who is our leadership in our communities. And so it was very helpful for me having these documents, and we have implemented them. And when I first came on the committee at our center, we weren't wearing masks all day. We were just wearing them coming in and out of the school, and the kids were wearing them coming in and out, and the parents at the door. So we decided we're going to wear our masks now all day, except when we're on the playground and at nap time, as long as the children are sleeping. And so it's, like I said, that's Susan was saying, it's evolving, and as we go, and we just talk to all our staff about, just stay flexible, go with the flow. We don't know what's going to change. But I do want to say all our parents were really, really happy with these documents. We send out surveys, and they were thrilled that we had some written material for them to read about what we were implementing to keep children healthy and safe, and keeping our staff healthy and safe, and keeping parents healthy and safe. And all the parents, they very quickly, after the first day or two of confusion about, oh, I come to the door, oh, I forgot I had my mask on, or we'll give you a mask if you don't have one. And even the children, in the first couple of days, they're looking at us like, who's that behind the mask? And then now they just kind of, they're gleeful about it. It's, they like to show off, Paw Patrol mask, or, a turtle mask. So that has been a really good positive outcome, that we're concerned about children with the masks. And we keep listening all the different ways people are being sanitary with the mask, and how to take them off, and how to clean, and what happens if someone gets sick at the school, and what do we do. So we're even going to publish, after we're finished with this committee, we have things going on our website, so parents can read ahead of time. Besides just when they call, we can have people know what we're doing in this new time of all our lives. And we don't know when it's going to end, so we're just staying open and flexible. And we hope that vaccines come along and things change. But until then, we are doing well with it. I was very surprised at the minimum amount of stress it was to reopen. I was surprised that our staff also were kind of happy about, we're being very strict about, you have to be there by 9 at the door, because we only have so many people to be at the door. And so we're getting our classes started without someone coming in late. And so that's been, and the teachers are really enjoying that they're able to be in their classroom without interruptions of parents, even though we love our parents to visit, you know, that's been a plus right now. And we've all gotten all our classes also on communications with like Class Dojo, which is some of the things listed on here. And that's been a really huge thing because the parents know they can talk with the teacher sometime during the day. They're seeing pictures of the children during the day, and that they can communicate with us at any time, or they call the office. If need be, I'll meet a parent outside, or anyone who wants to visit the school. We tell them what our protocols. We're doing up some videos for them to see the inside of the school and to meet our teachers online. But you know, if we're meeting anyone, we meet outside. We all have our masks on, and it's not been an issue. In the beginning, we were worried about getting supplies, and I've heard there is now a second wave of maybe difficulty getting supplies. So we have a little backlog just in case that happens. And, you know, it's been wonderful to talk to different directors. I live down and work in South County. So the directors down here, we kind of stay in touch with, you know, where are we getting supplies and what are we doing in our schools. And so it's, as we all know, how wonderful it is that we have each other. It's great to talk to all my teachers, but it's so wonderful that we have each other to talk to, because we often can't share some things with our staff that we might like to, but you know, it's talking to other directors. We all have a common problems and common experiences, and we get good ideas from each other. And so this kind of forum, I find, is very proactive, and will help St. Mark's Preschool going forward with you know, keeping up best practices. And if I have a crisis, I know there's people I can call and get some ideas of things to do. But this document is really, and I really thank everyone who's been part of putting this together. It's just been really wonderful with Kelly and Janet, and we're very thankful to have such wonderful leadership that we can, as a community in this crisis in a short period of time, have excellent material given to us that is solid and good. So thank you for listening.
Thanks, Barb. It's really good to hear from you know, a director in the field, because everybody on the call, for the most part, are the directors, are the ones, as Susan said, are responsible for this. And so I am very happy that the document was developed by directors, because it shows that it, you know, it had the practical component. It was vetted by additional directors. Of course, some of my staff have been directors, so they were part of that, but also, you know, it's better that it comes from you all. And then that is part of what today's meeting is about. So we have sent out the document a couple of times, and it is posted on our website, but we wanted to make sure there was an opportunity for everyone in the community who could participate in today's call to, you know, share any other comments or express concerns if there's sections that need to be reworked, but you know, I think the main message here is that this is a document that is meant to be a starting point, a minimum practice, a tool, but you know, there has to be flexibility, and every director, every site will do what is best for themselves and their families, but having this shared minimum protocol tells the community, as many of you have spoken to, that our industry is prepared, professional, taking this seriously, and you know, have our act together, you know, in this time of uncertainty. And that is important, because I think often the field is underestimated for what we do for children and families. So that is great. So for those who don't, I see some chat. I know my staff is monitoring the chat, but Kelly posted the document on the chat, in the group chat. So if you don't have the document, we have sent it out. Our email group goes out to the directors. So if you're not a director, and check with your director as to why they haven't shared it with you. It's also posted on our website, and we of course will send out again. And then if there's a way that we capture who logged on to this call, I think there might be, we then can add you to the distribution list to make sure that you get additional, you know, follow-up communication. So We have a
Janet-
director list, but we also have a general community list as well. Yeah, Claudia.
And Janet, I do want to update our numbers. We have 70 folks on this call today, which is awesome. They're just committed to the quality. Bridget is monitoring that chat. There are a few questions. And if you go into the chat, I think that's the best way. Should we, Bridget, do you want them to put their name and email address if they don't think they're on the list in the chat?
Yes, and I just want to confirm that there's a Q&A after this, Janet.
Is that,
Yeah,
is that true?
We're gonna open up questions. Okay,
Yeah, we
sounds
can,
good.
for sure.
I'm definitely taking the questions down, and we'll definitely address that at some point. Could I just have everybody maybe type their name into the chat section? I see so many of you have first names, or maybe it says director or teacher one. If you can make sure that your name is within the chat, so that way we can capture that.
We can follow up. So,
Work some of the questions that have come in through the chat. I think the one is regarding the Manatee County. This exercise was really done with our Sarasota County providers, but it doesn't mean that we couldn't share this with Manatee County as a starting point. I don't know if Janet, if you've had that conversation with them or not.
no, not yet, but I mean, we always do share among ourselves, so absolutely we can share.
Janet, I know that Kelly Harbor, I think it was at ELC Manatee, said that there was something locally, a task force as well happening in
They were
Manatee.
working on it.
I thought
Okay.
it was the same one. So I think something is brewing there. So I'm sure it'll coincide nicely. Share information.
So, and just for those of you who didn't get the original email communication, there's also a social media campaign that the Association of Early Learning Coalitions has been spearheading, but recognizing that every local community would do it differently. And that is a social media campaign to alert parents to the fact that there are common protocols, and to ask their provider about that, and be sure to ask certain questions, and so, because absolutely parents have to be comfortable in order for children to return to care. So I think that's still, Bridget and Anna have been working on that, and I think that is going on now. And
Yeah,
so
we're continuing it.
and so what's good is that these guidelines are here so that parents can be referred to review these guidelines as well, and then ask their provider about them. So
Janet,
So-
if I may,
Yeah, of
since
course.
we have Chuck on the line and also our colleagues from licensing, I thought if anyone has questions for them while we have them, their attention and time, anyone
Yes.
wants to chime in, you can either speak up, unmute yourself, or if you're more comfortable typing something into the chat room, but questions for the Department of Health or your licensing officials.
We have a question in the chat from Estella, and it states, do you feel comfortable if we only have kids wear shields versus masks during the day? Is it enough?
Yeah, actually, Chuck, maybe you could speak to that, because this has come up before, even with the shields for the teachers, that people are saying, can we wear the shields as opposed to masks? Is it just as effective? And that's because they want the face to be able to be seen. So we did have a little bit of discussion in our work group on that, but we didn't resolve that. So Chuck, if you're still on the call, I'm hoping you can answer.
Yes, I am here, and that's a topic that's been banted about a little bit at the CDC level in the last 2 weeks. The general consensus that I'm hearing from CDC is that while they may be helpful, they don't really serve the same purpose as a mask. And that's because the mask is primarily there to prevent the wearer of the mask from possibly spreading their germs to others as rapidly, not so much for the protection of the wearer. The face shield is really developed to prevent airborne droplets from coming in contact with the eyes or the mucous membranes. If you didn't have a mask, it could provide some protection there, but it's still open on the bottom. So as in terms of the purpose of the mask, it really doesn't accomplish that purpose, because as people talk, breathe, sing, their exhalation still exits the bottom of the mask, and so it's not capturing it like a face mask would. So for that reason, I don't recommend face masks alone as a good alternative, especially in the childcare setting when it's often adults that may bring something in unknowingly and breathing everything downward towards the children.
So wait, you meant face shields
Face
alone?
shields, yeah.
Yeah.
Face
good,
shields
'cause-
alone.
So we're still
Right.
saying that the masks are the recommended best practice.
That's correct.
That's right. Yeah.
You will see in the hospital setting, they have a high-tech, essentially, it looks like a face shield, but it's closed on the bottom and it's got air support to it. So they don't have to wear a mask and have better visibility. But I don't see those being practical to adopt in the childcare setting.
Now there has been a lot of discussion about the clear masks. You know, people are starting to produce masks that have the clear face, and so they're more costly than the others. And you know, there's been debate about whether those can be washed or reused, and the people producing them are saying no. So that would have to be taken into consideration. That the recommendation is that those masks are not intended for multiple uses. They're intended for one-time use, but they do have a clear face that, you know, people can see through. Yeah.
So from a practical standpoint, you know, if it came down to wearing a face shield or nothing, and the children were willing to wear the face shield, that offers some protection. It absolutely does. It's just not I can't say it's the equivalent of a face mask. So it's all things to consider. And as many of you have heard me say before, I think it's very difficult to mandate masks for children at the age that you're dealing with in your centers. It's great to hear some of the comments today where it's become a fun thing for children because that's how you're going to get compliance. But I certainly don't want to turn it into a really negative thing that causes problems. And in fact, CDC recommends that children under 2 should not wear a mask.
Right.
So.
Yeah. So I think the message is that we, and Susan said that and others have said it, is that we do the best that we can in the circumstances we're in and then strive to do the best we can and meet the best possible protocols that are there. But, you know, we have to just be realistic about various things. And as I said, each site makes their own decision about what they can do. And I do know that some tried one thing and they tried another. And then, so you evolve and you experiment and you keep dialogue open. And there is a question there about, and this isn't necessarily for Chuck or licensing, so we may just table this for the moment to see if there are other questions for that. But about parents not taking the precaution. I mean, that relates to, I'm just going to say, we can talk about it more in depth, but you have to require parents to do, I mean, just like you have parent handbooks, you have requirements for parents to participate and attend your site. And if someone is not following what you have established, then that has to be handled. But I'm sure we can have more dialogue on that. I just wanted to make sure there wasn't any other question.
So Janet, I would like to comment on that framework and expand it not just to parents, but to staff.
Yeah.
And I say that because I have the insight of seeing the investigative notes on many cases and outbreaks across our community. And we're seeing a trend more and more where I think everybody understands they should stay home if they're sick. But where we're seeing a problem is people will continue to work when they have someone else in their household who is sick, when they know they've been in contact with someone that was sick, and it may even be close enough contact that they themselves have went and gotten tested because they're concerned, but they don't connect. They're not trying to do something wrong. They don't connect the fact that if they're in that situation, they should exclude from work as well and not continue to work, because if they get sick and they've been working, they've then exposed everybody at your center. So that's a really important thing to continue over and over to put out there as an education piece, both for parents and for staff.
Right.
Yeah, that's Janet, and very interesting point. And then I've read different pieces of information about the last weeks, and I unfortunately belong to many of those social media mommy pages, and it's a tough situation when these parents, some know that they're sick, but if they don't go to work, they may be in worse times. And that's, so everyone's dealing with so many levels and so many tiers of need to stay afloat and have a livelihood and need to protect themselves and their children. And it's tough all around, all kinds of families.
We have
Oh, yeah,
another
Chuck.
question in the chat box, and Chuck, this might come back to you. Heather said, what about the face shields that are collar resting? Collar resting face shields.
Chuck,
Sorry, I
you're,
had to unmute.
Yeah.
So I have not seen those or read data on those, so I'm unable to comment about that, but I'll make a note and see what I can find and get that back to Janet so she can share that with everyone.
okay, thank you. It seems like every day somebody's coming out with a new version of different things, trying to meet a need. So yeah, that would be great, Chuck, if you could let us know.
I just wanted to bring to everybody's attention that the document is within this chat. Kelly posted it there, and I think Janet also mentioned that it would be sent out after this call as well.
Yeah, it was sent out and it is on our website, but we will resend it to everyone on this call. Yeah.
Chuck, one of the questions I'm hearing from time to time is about shoes, children wearing shoes into the center. I know that's going to be unique from program to program, but do you have any comments about that?
Well, shoes in general certainly can traffic dirt and pathogens into a center. So, you know, there already are some centers that remove shoes, but as a general practice, I don't know that that's a standard recommendation that's out there. I'm not as concerned about what comes and goes on children's shoes. There is certainly the capability of this virus to transmit from surfaces, which is why we clean surfaces, but primarily that's thought to be surfaces that these respiratory droplets would eventually settle on. So your horizontal surfaces, tables, chairs, and your common touch points where people's hands that may be contaminated from touching their eyes, nose, or mouth touch the doors frequently. Far more important, I believe, than shoes.
Thank you.
We have another question in the chat box from Linda. She stated, considering the assumption of the risk waiver included in the information we received, is this a best practice and something all centers should require of our parents?
Who would like to comment on that? Susan, this may have, Florida Center may have started with one of those kind of documents.
Can you repeat the question?
Sure. Considering the assumption of the risk waiver included in the information we received, is this a best practice and something all centers should require of our parents?
And that assumption of risk waivers was the document that was within what was sent out, is what Linda's talking about.
So this is Catherine from the Florida Center, and maybe I can comment on that. When Susan and the team were working on putting these things together, I did consult with our attorney, and we really felt it was best practice to include the waiver because we're a Sue Happy society in general, and this, you know, although it's not 100% foolproof, the parents are understanding the risk involved in bringing their children to the center, and they are accepting the risk, and it does protect the agency, I think, from potential lawsuits. So I think it's a wise thing to do.
Yes, thank you, Catherine. I think that each center needs to determine that for themselves, but clearly it's a document that then informs parents and makes them reflect and think about it. And I think it seems to me that the committee determined that that was a best practice. And but again, all of these are up to the centers to make those final decisions. But that makes sense. And the fact that, Catherine, you had an attorney review that, and I think that makes it even a stronger document.
Janet, this is Kathleen at Children First, and I would just like to make a couple of comments here.
Yes.
The first is we also had a waiver reviewed by our lawyer, and the lawyer strongly recommended that we employ such a document. We are currently reworking the document that we intend to use with parents. However, it was strongly advised. The other thing I just want to mention is a reminder regarding where children play. So children play on the floor. And so they are, I've seen children actually laying on the floor with their faces on the floor. So whether there is a determination to remove shoes before entering a classroom or having school shoes or not, I think what we need to look at is the underlying rationale behind such a decision. And that is that children do engage on that surface routinely. So the floors need to be clean. However the program decides they're going to keep those floors clean, that's up to them. However, just remembering that it is a frequently touched surface by children.
I think your point about school shoes is good, because one of the things that concerns me is if you think about an evacuation, how are you going to, if you just take them off someplace, get those on quick enough? So you made a really good point about a pair at the school that will only be worn at the school.
Yeah, I see someone else commented on that as well, that they have a space where children take off their shoes and put on what they call house shoes. Yeah. There's a couple of questions about temperature measuring. It seems there might be an issue with staff taking children's temperature during the day. Does someone want to comment on that? It's a question for the health department. So Chuck, maybe is it something that should be done routinely during the day?
So I'm just looking at the question. The question seems to be more about do we need a document for the parents authorizing the temperature for children?
Right.
I can't speak to the legality side of that. That's not my specialty area, but generally speaking, the big question that everybody has on the healthcare side is if we take temperatures, do we have to document those? And I don't recommend that. I don't want to create a medical record.
Right.
I think it's a spot check to see are children well and are they running a temperature, and it's something we've done forever in the child care business. If a child seems ill,
Yeah.
we maybe it's just touching them to see if they're warm, but we typically will call parents and say, hey, we checked their temperature. And
Right.
now I understand in the child care setting there's concerns about how the temperature is taken, and so I would recommend for this purpose that we use non-invasive things like forehead monitors or the although they're not quite as accurate, the infrared thermometers that are no touch are best. They're starting to be more and more available out on the market now. For a while they weren't available.
Yeah.
There's some ear ones with disposable ear cups that can be thrown away. All of those are things that can be used pretty safely with children.
And then Chuck, you raise a point that I just want to remind people. I mean, you all have, previous to this whole incident pandemic, you've had children come to your center and they do get sick during the day. I mean, so remember that we've had, you all have had protocols in place for years about how you handle, if a staff member gets sick during the day, if a child gets sick. I mean, don't forget that you know how to do this. I mean, and yeah, so I don't know that I can't comment on are you going to be checking children all through the day, but clearly if a child seems like he's ill or he or she is ill, you're going to do what you would have typically done, which is to determine the extent of it, contact the parent and follow through with that. So, I think we have to remember that you all know how to do this. You've been taking care of children for years. Almost all of you on the call have been doing this for years. So let's not forget that you already had protocols in place for some of this.
So there's a couple more questions. Christine has asked, will there be better guidance on what to do when someone is diagnosed with COVID-19 in your center?
Can I just kind of clarify that a little bit? My center just did have a COVID-19 case that, and we've been closed. We were closed Friday for the 4th, and we just haven't reopened yet. And Jill has been amazing with helping me and assisting me in what I need to do with the staff and the children and everything. But there are a lot of questions, not health department related, but I mean things like, I would love to pick the brains of some other directors on, parents' questions are, is it safe for their children to get tested? A lot of them don't want to test their children. Some of the parents are questioning us about tuition. Are they going to get reimbursed for the 2 weeks? Teachers are asking questions of, it's not our fault. Now we have to go another 2 weeks without pay. So, I mean, is there a time that we could maybe get, not today, obviously it is too long of a subject, but maybe get some directors together and start coming up with some plans on how people are addressing those kinds of questions?
I mean, Chuck might want to comment on that. I mean, I know that from the incidents that we have had so far, and there have been incidents in our community, that it's almost like each one is an individual situation, and it depends on the level, the extent of the exposure, where it happened, how many other people involved. That's why that contact tracing is so important. And I know that for some sites, they've been able to more quickly reopen. Some have had to remain closed for a certain period of time. So I think depends if it's a staff versus a parent, a child. So yeah, so Chuck, I don't know if there's a quick comment you have about that, or I think that's why we advise contact with the health department and with licensing, because each situation is really individualized.
So, a couple of comments here. One, I would encourage any center that becomes aware of a child or staff member that's ill, or you hear that someone was tested positive, to explore that and feel free to contact the health department. Believe it or not, there are many times that individuals receive their results from a lab a day or longer before the health department gets them through the state reporting system. Normally that's not the way it happens, but with a little over 1,500 to 2,000 tests a day coming out of Sarasota County and 10,000 tests a day around the state, the labs get a little bit slow in all of their processes. So we welcome calls and we can give advice. The advice on how to manage someone that's positive and the contacts is pretty straightforward. And all available on CDC's website, although it's hard to wade through. There's so much on that website, so it may be easier just to call someone and make sure that's clear, both cleaning requirements and how long someone has to be out within timeframes. Some of that's in the guidance that the committee put together, so I can call it out for positive individuals that don't work in the healthcare setting. The rule of thumb is they can return to work 10 days after their onset of symptoms. And if they never had symptoms and they only found out because of a test, we use that test date as the date of onset. So 10 days after onset of symptoms and, capital and, 72 hours symptom free. So as long as they've had no symptoms for 72 hours and it's more than 10 days since their onset of symptoms, they're safe to return to work.
So yeah, I mean, I have all of that information. My questions were really not directed toward the health department. My questions were, what are some other directors doing in regards to tuition? Are you guys still collecting tuition if you have to close down? Are you collecting half tuition and telling parents that they have to pay half of the tuition? I've heard, just to save your spot. Are you still continuing to pay your teachers? Mine are more policy child care center directed, just trying to pick brains of other directors and what they're doing so that I'm not way out here in left field, trying to pay my teachers and giving tuition reimbursements and everybody else is saying we're not paying teachers or something.
Hey, Christine, how would you like me to put that as an agenda item for next
Yeah.
week at the Directors Connection? And I think we'll just kind of pick some brains and see what we can come up with. And like you said, it's going to be an individual decision at every single center, but at least you'll have an overarching idea of what's happening in general across the county. So we'll add that to the agenda for next week.
Thanks, Claudia.
Uh-huh. And there's a question that came through that I'm particularly interested in the answer. I know of 2 centers in particular that have used a fogging system the last couple weeks. I'd like to hear from Jill, who I think is still on the call, or Chuck, the effectiveness of that system. I think Jill's on. I think I saw her back there somewhere.
Not hearing Jill. I'll be glad to hand it up to her if she wants to weigh in. You know, there are some good fogging systems out there that are very effective at disinfecting a space. There are others out there that aren't so effective. So the important questions are, what is the product they're using, and is it certified by the EPA for that particular use as a viricide, and is it effective specifically against COVID-19? And that's all should be in the labeling process and the literature that whoever's doing that fogging provides, or if you're doing it yourself, any equipment that you purchase and the material you're using. So you want to make sure that the product is appropriate for that use and that it's appropriate for use in a child care setting.
Thank you. Thank you.
We have another question. When a positive case happens in a center, is there guidance on what to put out to parents?
So this is Chuck again, I'll throw my 2 cents in. That's, you know, really that's a policy decision for each center. My recommendation and experience tells me that transparency is always the best policy. And if parents feel assured that you're going to keep them in the know, then they feel more comfortable with their children in your center. That doesn't mean you have to identify who or any specific details. If parents know up front, this is our process if we have a positive, and we'll do these things and notify the parents, but we don't disclose names, then that expectation is out there, and when it happens, they're not surprised. You know, we run into it all the time on the health side. People will say, well, that's silly not telling us the name. We all know who it is. And so I just smile and say, well, that may be, but I don't talk about names. We're just following our process, and we want to keep everybody informed.
And this is Catherine again from the Florida Center, and I'll just add my 2 cents too, Chuck. We have developed a protocol for if staff become exposed either in the workplace or outside of the workplace. We've actually had reconfirmed cases at the agency. One was brought in by a client. So we've got a protocol in place for if you've been exposed or you think you've been exposed, and then if you test positive. So I'm happy to send that to you, Kelly, maybe, to get with others. If that would be
You
helpful.
could send that to me and Janet.
Yeah.
Sure. Yeah.
We can add it to the revised document. Yeah, as an additional tool.
Okay, will do.
Thank you.
There's another question for Chuck. Caroline says, is it still 14 days for someone who has been in contact with, I'm assuming, somebody who was confirmed positive?
Yes. So the 14-day, if you want to be technical, it's a quarantine if it's someone that's in contact because they're well. So if they're well and we're asking them to quarantine away from everyone, it's because we want to make sure that if they become ill, they're not going to unknowingly infect others. And the 14 days comes from the incubation period for COVID-19. While most people will get sick within a 5 to 8 day window, it could happen as early as 2 days or as long as 14 days. So the 14 days is set up to exclude people from the workforce so they can monitor their health and make sure they don't get sick during that period and not unknowingly expose others. that 14 days starts from the day of their exposure, not necessarily the day it was reported, which often causes confusion because, especially with test results taking longer to come back, someone could get sick, could get tested, and maybe 7 days into their illness before they get their positive test and notify everyone. So then we've got to backtrack and figure out during their infectious period, when did they come in contact with people, and are we still in that 14-day window or not?
And I
But it
think
is the same 14 days.
And I think to jump off of that, I think it might have been Heather that asked that question. She would like to know what contact really means. Does it refer to close contact within 6 feet or just generally contact? I think that's a tough question to answer, but go for it.
It is a tough question, and every situation can be different. In the big picture, close contact means face-to-face discussion with one or both parties not masked, being within a 6 foot space, inside of the 6 foot space, and lasting for 15 minutes or more. That's the general guideline. You know, on top of that, we put in judgment. If people spend all day together in a 10 by 10 room, each in their own corner, so they're technically 6 feet apart, we would probably consider that close contact regardless, because they're going to be sharing a lot of the same air over a length of time. So there's a lot of common sense factors as you think about what each case did and who they were exposed to and for those time periods, and you make your best judgment call you can.
Thank you. If you're not speaking, maybe if you could mute your phone. There's a lot of chatter I hear going on, and it's kind of tough to hear the speakers at some point. So remember to mute if you're not talking.
In our state. The data is also seeing the highest number of percent positives. 51,000.
Okay,
We're
somebody's
muted.
still not muted. I'm going to go ahead and mute that person.
You can.
Yep.
I just wanted to point, we are at the 1 hour mark. And it sounds like we have some really good questions that will be shifted over to the director's call next week. Is there any final burning question that if you don't get answered in the next 60 seconds, you won't be able to go back to work satisfied following this call? Lori, you're muted, dear.
Lori, unmute.
I got it. Sorry. Not a question, but I do want to clarify with everyone on the phone. If you could jot down, it will be coming to you, but the telephone number that you should be calling is 941-861-2873. So disregard the old number. This is the number that you should be calling, and we have updated that in the document, and we'll be making sure you have that number.
All right, can you repeat that?
Lori, I muted everybody. So you need to, there you go. Go ahead.
It's 941-861-2873.
And Lori, also, didn't you say that Fatima wants to be notified by email so that they can be sure they're helping with it as well, right? Is that
Thank you, Janet.
Yeah.
Yes, I did speak with Fatima, and so that licensing is kept in the loop. If you will just please send them an email. You don't need to try to call, but just send them an email. If it is a parent or relative that's been in direct contact with the child, please let them know that also. It's not just necessarily a staff member or a child testing positive, but having that information about the family is helpful. So just shoot her an email and let her know what the situation is. And then also call the number that we've given you.
Lori, can you put the number in the chat box?
Yes. Thanks, Kathy.
So it sounds like there are a lot of other questions that directors need to talk to each other about. So if we have some of those that we've captured, and if you want to send Claudia or any of the coaches, what your burning question is for next week, so that they, as they formulate the agenda for that meeting, they can group questions together, and maybe there could be some small groups that talk among themselves to answer some of those questions. That would be great, because it does sound like there's a need for some peer-to-peer helping each other with some of those day-to-day details of what goes on. So
I think Wendy Wendy unmuted herself. I think she had a question, but she muted again, so guess not.
Okay.
No.
Wendy, do you have a? No? Any hands raised or something, or you
I
unmuted her?
unmuted you, Wendy, if you want to ask a question. I don't see any hands raised. Bridget, are you catching any hands raised?
None at this time.
Nope. Nope, it all looks good.
Okay, I'm sure the minute we end the call, people will have questions, so feel free to email them to us so we can capture them and continue discussing these issues in other groups. And I want to thank everybody for taking the time, I mean, really for you to take the time to get on this call and for everybody to be on this call. We really appreciate it. It shows how committed you are to this important issue. I thank Kelly for all the work that she's done. She really gets very different groups together and is able to have them work for a common purpose, and so that's been great. And all of the providers who have been on the work group and helping to develop these protocols, I just thank everyone for all of their hard work doing this. So if there's not any final questions.
I guess that's our ending music.
Okay.
Thank you so much, Janet and your team and everyone who helped build these guidelines. Appreciate all your time.
Thank you guys for being here.
We'll get through this.
Yep.
We will.
Thank
Yes.
you. Wonderful weekend.
Bye.
Bye now.